think about acne, you tend to think about teenagers, but you might be surprised to know that more and more adults suffer from it every year. My next guest has written a book about the facts and myths associated with acne. Please welcome the author of The Clear Skin Diet, Dr. Logan. Welcome to the show.
Thank you for being here. Appreciate you having me.
I think we should start off, and everybody probably assumes they know what acne is, but what is it really?
Well, it's technically defined as a disease of what's called the pilosebaceous unit. That's the fancy medical jargon for the pore and what lies beneath. And what happens is there's too much sebum. There's excess sebum. That's the oily substance that normally hydrates the skin, but there's too much of it being produced in acne. And the other thing that you have is there's too much sort of internal lining of the pore. Those cells are being overproduced. You throw in a little bit of bacteria into the mix and inflammation, and you get the end result of acne. And what happens is when that pore gets blocked up, it can spill out sideways, left to right, and then that can become a cyst and a very painful sort of acne lesion at that point.
Okay, so and this is not something that you're just seeing in teenagers, because I remember when I was a teenager, obviously, we all had issues with acne, but you're now seeing it in more and more adults, or it's just always been that way?
No, we've definitely seen an increase in acne rates, especially in adults, over the last 40 years, and this has been documented not only in North America, but even in countries like Japan, where they've seen a doubling in the rates of acne in the last 40 years.
So why do you think that's happening?
Well, of course, we can't write it off to genetics. Of course, acne is genetically mediated, but you can't. I mean, the changes, it can't be genetic. So you have to look to the environment. You have to look at stressors, and of course, most of us rate our lives to be more stressful today. And you also have to look at diet, and there's been major changes to the North American diet in the last 40 years with greater increases in sugar intake and processed foods, the wrong types of fats, and so forth. So you really have to look at those two factors.
Okay, so let's talk about the men versus women, because I assume that everybody gets it to the exact same amount. The ratio would be the same, but maybe with women you hear about it more. Do women have more issues with acne, or is it the same?
Yeah, no, you're right about that. In the teen years, it's fairly close. Boys may have a little bit more, but in adulthood, women definitely get it more. We've got a situation now where 1 out of every 2 women over the age of 26 years old will have some degree of acne. They're much more prone in adulthood than our men.
And what's the difference with their skin to allow that to happen?
Well, it may come down to the way we react to hormones, both the stress hormone cortisol and also the androgens. These are the so-called male hormones that drive acne in both men and women. And when we're under stress, women, when the cortisol production is promoted, they get more sebum production at the pore level than do men, given the same amount of the stress hormone cortisol. So that's one part of it. And the other thing is when women are chronically stressed, their male hormones, their so-called the androgens, they go up and up and up.
Define what you mean by stressed. I'm just like, what kind of stress would you be
Any
under?
type of stress, relationship stress, work stress, domestic stress, however it is that the demands of the modern lifestyle impact us, and if they exceed our coping abilities, that's stress. And it doesn't matter whether it's rush hour traffic, the demands of children at home, and in women, and the research is very clear about this, women have higher levels of that stress hormone cortisol Monday through Friday than do men.
And what happens on the weekend?
On the weekends,
you poor girls kick back? You need to kick back. Relax. On the weekend, get your husband to do the work.
Well, no,
take the kids to soccer.
You're absolutely right about that. Because the women's, we see the rates increasing in acne in working women in particular. Because when the working day is done technically at 5 o'clock or whenever it may end, it's not done. No. Women do more work. The research is clear about this in the domestic front, and that job never ends. And that's why it's really interesting that the stress hormone cortisol stays elevated Monday to Friday compared to the weekends. It's quite remarkable.
So let's talk a little bit about food. What can we do, what can you avoid to make, or maybe we should talk about what foods would actually trigger acne.
Well, again, the relationship between diet and acne has always been dismissed as a myth.
Okay.
There's no relationship between diet. We've been hearing that for the last 30 years based on the most absolute flawed science. It would never stand scientific scrutiny today.
Okay.
We've got some updated studies now, and we know that diets high in fiber, high in fish and seafood, in whole grains, so not the processed white flours and so forth.
Right.
In the 2 studies that have been published recently, there were 22 less acne lesions on the faces of those who adhered to that diet for 3 months. So what those foods do is they stabilize blood sugar, because we're finding out now that spiking insulin, which is the hormone that regulates blood sugar. When we do that through eating sweets, drinking pop, and processed foods, it actually is influencing the acne sebum production right at the pore level.
Okay, I don't want to mention any names, but there are some products that are on some home shopping network, not home shopping, just infomercials.
Sure.
And they talk about them and how the celebrities saying it's changed my life. Are they lying to us? Is it true?
Oh, A very tiny minority may see those overhyped claims that Hollywood celebrities endorse. The reality of the research behind things like benzoyl peroxide and glycolic acid is that half of those who use such products will see just a modest improvement. Users in research studies report about 4 out of 10 in terms of what they rate their improvement to be.
I think the biggest myth that I read that in the research that you have given us is that just because you have dirt doesn't cause, you know, people say that there's dirt lodged in the pores, then that's what causes acne, and you're saying that's not the cause of the acne.
It's absolutely not the cause of acne.
Because people look at, sometimes people look at people with acne. When I was a little kid, the people would say they think I'm dirty, and I wash my face 20 times a day. Washing your face 20 times a day is not going to help.
It actually can make it worse. The research shows that just twice a day washing with a gentle cleanser is the way to go in acne. And I'm so glad you brought up that point. Even blackheads are not black from dirt. They're black from the sebum and some bacteria reacting with air. That's all it is. It's not dirt. It's not from lack of hygiene.
I just think that misconception has to go, so kids can have an easier ride with this. Because it's not easy at the best of times, so don't make it worse. So everybody has to know that they are clean, and that is just a reaction in their skin.
You better believe I appreciate you saying that.
Thank you so much. Well, I'm very excited because you have brought a book for everybody in the audience. You're all going to take this home. It's the Clear Skin Diet. And thank you so much, Dr. Logan, for being here. Real pleasure. Thank you so much. We'll be right back, everybody. We will be right back. Coming up.
And what is that ingredient, you may ask? Let's just say